Hello, and thank you so much for joining me today. My name is Melissa Devine, and I am with the Medicare Medicaid Assistance Program through the Area Agency on Aging 1B. I'm here today to talk to you about how to transition from your Marketplace plan to Medicare. Today, we're going to cover the Medicare Medicaid Assistance Program. Who are we? What do we do? An overview of Medicare and how to transition from Marketplace to Medicare. Let's get started with the Medicare Medicaid Assistance Program, often referred to as MAP. MAP counselors are certified and have been trained in healthcare benefit counseling. This includes Medicare, Medicaid, and other insurance products. MAP counselors are not connected with any insurance company, and they are not licensed to sell insurance. In many states, the MAP program is often referred to as the SHIP program, the state's health insurance program. Now, a MAP counselor can help you understand Medicare health plans. They can help you compare and enroll in Medicare Advantage. They can help you compare and enroll in Medicare prescription drug coverage. They can help you identify and report Medicare and Medicaid fraud and scams. And they can also assist with enrollment into low-income programs like the low-income subsidy program and the Medicare savings programs. Now let's take a look at Medicare. What is Medicare? Well, it's health insurance for three groups of people: those that are 65 and older, those under 65 with certain disabilities, and those of any age with end-stage renal disease or ESRD. It is administered through the Centers for Medicare and Medicaid Services, or CMS, but enrollments often take place for most through the Social Security Administration, or SSA, or the Railroad Retirement Board for the railroad retirees. Medicare was originally created in 1965 as catastrophic health care coverage for seniors and the disabled. It does have some gaps or cost sharing included, which would be deductibles, coinsurances, things that the beneficiary would have to pay. And modifications do require legislative actions. It has been expanded over the years to include, among other things, prescription coverage, preventative services, and more. It also has well-defined benefits and exclusions. It does not cover dental or vision care except under special circumstances. It does not cover long-term custodial care, and it places limits on certain care items such as physical therapy, durable medical equipment. And it also does not cover over-the-counter medications. Medicare does, however, work with private insurance companies to provide Part D prescription drug coverage, supplemental or Medigap plans to help fill in those gaps in original Medicare, and with Medicare Advantage plans, those are the plans that combine the parts of original Medicare A, B, and D together, so giving you that prescription drug coverage and often some dental, vision, and hearing coverage. The Affordable Care Act of 2010, also referred to as the Health Care Reform, included a number of provisions that affect people with Medicare, as well as those aging into Medicare. Under the Health Care Reform, people with Medicare now have little to no costs for many preventative services. Some of these services include an annual wellness visit, cancer screening tests such as mammograms and colonoscopies, a Welcome to Medicare physical, and a chart of these covered preventative services will be listed here later in the presentation. The Medicare Part D coverage gap, sometimes referred to as the donut hole, occurs when seniors exceed a certain amount on their prescription drug costs during the year. Previously, seniors who had reached the donut hole would be responsible for paying the costs of their prescriptions in this gap. However, the Affordable Care Act is helping to close that coverage gap by enabling people who reach the donut hole to receive deep discounts on their medications. In addition, the ACA expanded health coverage to all Americans through the creation of federal and state marketplaces. This is where individuals and small businesses can purchase insurance. These marketplaces are designed for individuals who do not have Medicare yet, but many people do still have questions about how they work for older adults and how those enrolled in marketplace plans can effectively transition to Medicare when they first become eligible. To get information on this, you can visit with the Medicare.gov website. Of course, seniors who want to buy Medicare Advantage plans, Part D plans, and or Medigap plans need to continue to do so through Medicare.gov, the MAP program, and or even the plans themselves. Now let's move on to the Marketplace transition into Medicare. If you're turning 65 and are currently enrolled in a Marketplace plan, you may have a lot of questions. First is going to be, what do I do next? When you're first eligible for Medicare, you should enroll into it. Your eligibility for Medicare happens when you turn 65. You have an initial enrollment period that begins 3 months before you turn 65. It includes the month you turn 65, and it ends 3 months after you've turned 65. If you have a Marketplace plan, you can keep it until your Medicare coverage starts. However, once you have an effective date for your Medicare coverage to begin, you can notify your Marketplace plan to disenroll from that Marketplace plan the date your Medicare coverage begins. If you like, you can keep your Marketplace plan too, but once your Medicare Part A coverage starts, you'll no longer be eligible for any premium tax credits or other cost savings that you may be getting for your Marketplace plan. So you'd have to pay full price for the Marketplace plan. And if you delay your enrollment into Medicare to keep your Marketplace plan, you will end up with late enrollment penalties when you do choose to enroll into Medicare. And in some cases, you risk the delay into Medicare coverage dates, providing a lapse in coverage. If you and your family were enrolled in a Marketplace plan together prior to you turning 65, you can make changes to your coverage by disenrolling only yourself from the Marketplace plan and enrolling yourself into Medicare coverage. Automatic Medicare enrollments only take place when you're drawing Social Security retirement or Social Security disability payments. When you're receiving these benefits, you must take Medicare. And if you were to choose to delay enrollment into Medicare for a Marketplace plan, you will have delays in coverage to get Medicare. You'll be subject to late enrollment penalties and more. If you choose to delay enrollment into Medicare, you'll also lose your Social Security benefits. You'll have to pay back any prior Social Security benefits that you received, and you'll pay back any health benefits that you'd received from Medicare prior to canceling the coverage. It can end up being quite a costly adventure. Now, can you have both Marketplace and Medicare? Yes, you certainly can, but they will not coordinate. One coverage will not pay secondary to the other. And as long as you continue to pay your Marketplace premium, the insurance company cannot drop you. So you'll have to choose if you will use a Marketplace plan or Medicare for your health services when you're receiving them. Now, it's worth repeating, you will not receive your Marketplace premium tax credits once you're enrolled in Medicare. Now, when should I cancel my Marketplace plan? Well, as soon as you know your effective date for Medicare, you want to log into your Marketplace account. You can select to terminate the plan for the day or even for a time frame in the future, up to 30 days. You can also call 1-800-318-2596 to disenroll as well. And if a family member is remaining in the plan, make sure that you cancel yourself only 15 days prior to the end date that you're requesting. Now let's take a look at some of the Medicare basics. If someone is already receiving Social Security benefits, for example, they're getting early retirement benefits, they will be automatically enrolled into Medicare Part A and Part B without an additional application. They will receive an initial enrollment period package, which includes their Medicare card and other information, about 3 months before their age 65, or 3 months before their 25th month of disability benefits. Coverage begins for those that are on disability benefits the 25th month of their disability benefits. Now, if someone's not getting Social Security or Railroad Retirement Board benefits, for instance, maybe you're still working, you'll want to sign up for Part A. Even if you're eligible to get it for premium free, sign up for it when you turn 65, but you could potentially delay your enrollment into Medicare Part B. Now, if you are retiring completely, you'll certainly want to take both Part A and Part B, and you'll want to do so during your initial enrollment period. That's contacting Social Security 3 months before turning 65. And of course, if working for the Railroad Retirement Board, contacting them to sign up. Now, while Medicare is administered by the Centers for Medicare and Medicaid Services, Social Security Administration is responsible for enrolling most people into Medicare. The Railroad Retirement Board is responsible for enrolling railroad retirees into Medicare. You can enroll by visiting the local office or contacting Social Security at their 800 number listed here on the slide, or online through ssa.gov. Again, if retired from the railroad, you'll want to do so with the Railroad Retirement Board through their 800 number listed here on the slide. Now, you don't have to be retired to enroll into Medicare. If one's not automatically enrolled, you can choose to sign up during your initial enrollment period. That is that 7-month period that begins 3 months before you turn 65. It includes the months you turn 65, and it ends 3 months after you turn 65. This year, the premium for Medicare Part B, because you will have a monthly premium to pay, it is $164.90 a month. Now, Social Security does advise people to apply for Medicare benefits 3 months before they turn 65, just so that there is no issues in time, especially if they need any further information to review full retirement ages, etc. Now, during your 3 months, the first 3 months of your IEP, your initial enrollment period, in getting Medicare Part B, you will begin that coverage the first day of your birth month. If you wait to sign up during the last 4 months of your initial enrollment period, you will have a little bit of a delay in your enrollment start date for Part B. This is a look here of the original Medicare ID cards. They are red, white, and blue, and they are used for beneficiaries when they are receiving their health care. This Medicare ID card does show coverage for Part A, Part B, their effective dates in the month, day, and year format, along with a set of numbers and characters unique to just that individual. Now, when you enroll in Medicare, if you want both Part A and B, you want to keep that card. However, if you are choosing to delay your enrollment into Part B or refusing Part B, flip that card over, follow the instructions on the back, and get that card sent back so that you can have an updated one showing only the Part A coverage. Now, Medicare does have 4 parts. There is Part A, hospital insurance, Part B, medical insurance, Part C, Medicare Advantage plans, and those are the HMOs and PPOs. And then there is Part D, the prescription drug coverage. Now, when you first enroll into Medicare and during certain points of the year, there are ways that you can choose how you receive your Medicare coverage. Usually the first route for individuals is through Original Medicare. That's keeping that red, white, and blue card with Part A and Part B coverage. You select then a Medicare Part D plan, and then you can choose to enroll in a Medigap policy. Those are the supplemental insurance policies and help to pay those out-of-pocket expenses in Original Medicare. The other route for Medicare coverage is going with a Medicare Advantage plan or Part C plan. These are those 3-in-1 plans. They include Part A, Part B, Part D coverage, all in one policy, and they are HMOs and PPOs, often with some extra benefits like dental, vision, and hearing. Now, Medicare Part A is hospital insurance, and it does help pay for medically necessary services in a hospital inpatient care setting, skilled nursing facility, home health care facility, and some hospice care. With Medicare Part B, the medical insurance, that is going to help cover medically necessary services and supplies when certain requirements are met, with doctor visits, outpatient hospital services, clinical laboratory tests, and preventative services, and more. This chart here shows the various costs for hospitalization or Part A coverage with Medicare for 2023. Now, for most individuals, there is no Medicare premium for Part A. However, if you do have to purchase Part A, the premium does vary depending on how many credits you've paid into Medicare. Now, for those who have 30 or less credits, you will be paying $506 a month. And for those between 30 to 39 working credits, you would pay $278 per month. Now you can see here on this chart in terms of coverage for Part A, under hospitalization, under the first 60 days of a benefit period, the beneficiary is responsible for a $1,600 deductible. After day 60, days 61 to 90, it is $400 a day at a hospital inpatient setting, and that would be admitted to the hospital. Days 91 to 150 is $800 a day, and anything beyond 150 days incurs all costs to the beneficiary. For skilled nursing facility visits, the first 20 days is covered at no charge to the beneficiary. However, any additional 80 days is up to $200 a day, and anything beyond 100 is all costs to the beneficiary. With home health care, up to 100 of those days following a 3 full day hospital stay under admission, as long as medically necessary and meeting Medicare criteria, nothing is required by the beneficiary for the services. However, there is a 20% coinsurance for the approved amount for any durable medical equipment. For hospice coverage, as long as the doctor certifies the need, it is unlimited with no costs for outpatient, except for outpatient drugs and inpatient respite care. And for any coverage for blood, it is unlimited as long as medically necessary for the first 3 pints. Now this chart here does show the general charges for Medicare Part B. Now, if a client is eligible for Medicaid or extra help, which this will be discussed a little bit later, some of these charges may be reduced. Now, the monthly premium, again, for Medicare Part B in 2023 is $164.90. And for coverage under Medicare Part B, medical expenses, so doctor services, physical and speech therapy, diagnostic tests, durable medical equipment, etc. Those are unlimited services as long as medically necessary, with a 20% coinsurance for the approved amounts after the Medicare Part B deductible has been met. Now for 2023, the Medicare Part B deductible is $226. For any clinical laboratory services like blood tests, UAs, and more, again, unlimited if medically necessary, incurring no charges to the beneficiary. For home health care services, those are unlimited as long as you meet Medicare's conditions. Again, nothing for these services, however, a 20% coinsurance on those approved amounts for durable medical equipment. And outpatient hospital treatments are unlimited as long as medically necessary, with a 20% coinsurance of the approved billed amount after that $226 Medicare Part B deductible is met. And for any blood that is needed, it is unlimited if medically necessary, where the beneficiary pays for the first 3 pints plus 20% of the approved amount for the additional pints. Now let's take a look at Medigap. Medigap policies are private health insurance policies that cover only the policyholder. They are sold by private insurance companies to supplement the original Medicare or pay for those gaps in original Medicare coverage like deductibles, coinsurance, and copayments. They pay for Medicare covered services provided by any doctor, hospital, or provider that accepts original Medicare. Medigap may cover certain things that Medicare doesn't, depending on the policy as well. So you will see some plans offering dental, vision, and or hearing discount programs or additional riders for the coverage. All of these plans, though, must follow federal and state laws that protect people with Medicare. And we could do an entire presentation on Medigap alone, but this next slide is going to show us what Medigap policies cover. So if you have any questions regarding Medigap policies, please feel free to reach out to us at MAP. We're happy to help. As you can see here, though, all of the plans, regardless of letter A through N, do have to offer basic benefits. Those include the Medicare Part A coinsurance and hospital costs up to the additional 365 days after Medicare benefits are used up. Covers the Medicare Part B coinsurance or copayments, blood for the first 3 pints, and the Part A hospice care coinsurance or copayments. Now, each Medigap plan covers different additional benefits. Just a note though, plans C and F are no longer being sold to Medicare beneficiaries who are new to Medicare on or after January 1st, 2020. While they do cover those Part B excess charges, the price of these policies is going to increase as the risk pool decreases. So often we take a look at all of the plans that are available, with the next best options being a Plan G for F and a Plan D for C. Now let's take a look at Medicare Part D. While technically Part D is optional, in most cases there are penalties to not enrolling into Part D coverage. Part D is the most complicated part of Medicare. It involves researching plans, comparing prices, and much more. MAP counselors are trained to assist beneficiaries and take the stress out of enrolling. People with limited income and resources may also be able to get extra help to pay for those Medicare drug plans. There are different rules at that point then for how to choose a plan. Now, most of these plans do have their own formulary lists, and you will have to pay a monthly premium for your Part D coverage, and there is deductibles and copayments involved. You must have Part A and or Part B in order to enroll into Part D. You must live in that plan service area. You cannot live outside of the U.S. You cannot be incarcerated, and you must enroll in a Medicare Part D plan. In most cases, there is no automatic enrollment, so you must fill out an application, which you can ask MAP to help with. Our counselors are ready and able to do so. Medicare Part D is the prescription drug coverage for original Medicare, and this coverage is provided through prescription drug plans. You can also receive prescription drug coverage through Medicare Advantage plans, but oftentimes these Part D plans are going to cover a range of drugs in many categories. You can join a Medicare prescription drug plan when you first become eligible for Medicare during that initial enrollment period. Again, that's the 3 months before you turn 65, the month you turn 65, the 3 months after you turn 65, or by the 25th month of having your Medicare or your Social Security disability benefits. Now, if you've been in Medicare before, after you've made your first enrollment, you must remain with that plan for the remainder of the calendar year. However, you can choose to enroll in different Medicare Part D coverage during the annual open enrollment period, which is October 15th through December 7th each year. You can also change your Medicare Part D plans during the special enrollment periods. There are many, there are too many to list in this presentation alone, but this can all be reviewed under the Medicare in You book by reaching out to MAP and or even reaching out to the plans directly. Now, if you do not have creditable coverage and you choose to not enroll in Part D when you are eligible for it, you will end up having to pay a late enrollment penalty. The penalty will be added onto your monthly premium, and it will continue for the entire time that you have Part D coverage. This Part D late enrollment penalty is calculated by taking 1% of the Part D base beneficiary premium, which is $32.74 in 2023, and it is for each month that a beneficiary did not have creditable coverage and was not enrolled in Part D. And that penalty amount does change each year as the Part D base beneficiary premium changes, so there is the potential for it to go up. This is a look at the basic Part D structure for Medicare in 2023. For most Part D plans, you will see that there is a deductible. For those that are having to pay for prescriptions in that deductible period, you will, until you've met that Part D deductible, pay full price for the full negotiated price for those covered prescription drugs. Once you've met that deductible, the plan will then begin to cover the cost of the medications. While deductibles will vary from plan to plan, there is no plan's deductible that can be higher than $505 in 2023, and some plans have no deductible. Now, after you've met your deductible, your plan will help pay for your covered prescription drugs. Your plan will pay some of the cost, and you'll pay a copayment or a coinsurance. How long you stay in the initial coverage period does depend on your drug cost and your plan's benefit structure. But for most plans in 2023, the initial coverage period ends after you've accumulated $4,600 in total drug costs. Now, total drug costs does include the amount that you and your plan have paid for your covered drugs. After your total drug costs reach that $4,600 for most plans, you enter into what we call the coverage gap, which was previously known as the donut hole. The donut hole did close for all drugs in 2020, meaning that when you enter the coverage gap, you are only responsible for 25% of the total cost of your drugs, regardless of brand or generic. Although the donut hole has closed, you may still see a difference in cost between the initial coverage period and the donut hole. For example, if a drug's total cost is $100 and you typically pay $20 for a copay during the initial coverage period, you will now be responsible for $25 instead, because it is 25% of the cost of the medication, which was $100. Now, in all Part D plans, you will enter a catastrophic coverage phase after you've reached $7,400 in out-of-pocket costs for those covered meds, or when Medicare has been billed in total $11,206 in retail costs for those covered meds. This amount is made up of what you pay for your covered drugs and some costs that others have paid. During this period, you will pay significantly lower copays or coinsurances for your covered drugs for the remainder of the year. The out-of-pocket costs for that help you reach that catastrophic coverage includes your deductible, what you've paid during your initial coverage period, almost the full cost of the brand name drugs, including any manufacturer discounts that you've purchased during the coverage gap, any amounts paid by others, including family members, most charities, and other persons on your behalf, and any other assistance programs that you may have within your state. Some Medicare prescription drug plans may offer more than standard coverage, including tiered copayments or coinsurances, lower deductibles. They may even eliminate the gap in coverage, where the beneficiary would pay 100% for their prescription costs. This change in the coverage limit can even be a different dollar amount, where a beneficiary would begin to pay 100% for their meds. Now, Medicare Advantage is also known as Part C. These are the health plan options that are approved by Medicare, run by private insurance companies, and are either an HMO or a PPO. Medicare does pay an amount for each member's care, and Medicare Advantage plans are another way to get your Medicare coverage. If you join a Medicare Advantage plan, you will have to use their network doctors and hospitals. Medicare Advantage plans are health plan options that are approved by Medicare, offered by private insurance companies that have signed a contract with Medicare. They are a part of the Medicare program, so Medicare will pay a set amount of money to these private insurance plans for their members' health care. And in a Medicare Advantage plan, you may have to use doctors and hospitals that belong to the plan's network. You will still have all Medicare rights and protections, and you'll still get all of your regular Medicare coverage, Part A and Part B services. You may even get additional benefits offered through the plan, including prescription drug coverage and extra benefits like dental, vision, hearing, and other health and wellness programs. Benefits and cost sharing may be different than original Medicare, but in all plans, you usually pay a deductible, copayments, and coinsurances that will vary by each plan. Now, you can enroll in a Medicare Advantage plan when you first become eligible for Medicare during your initial coverage election period. That's going to be that IEP. That's the 7 months, beginning the 3 months immediately before your first enrollment into your first entitlement into both Medicare Part A and B, or during your annual election period, also known as the open enrollment period. That is October 15th through December 7th each year. In certain situations, which could provide for a special enrollment period, you may be able to change before then. Now, you can only join one Medicare Advantage plan at a time, and enrollment in a plan is generally for a calendar year. Again, if you have a special enrollment period, then you may be able to change prior to the annual open enrollment period, October 15th through December 7th. However, if you are enrolled in a Medicare Advantage plan on January 1st, with coverage beginning January 1st, you can utilize a Medicare Advantage open enrollment period, January 1st through March. This is going to allow you to make changes during that time, either to a different Medicare Advantage plan or back to original Medicare. You can make enrollment changes by contacting the plan directly through their telephone number, visiting Medicare.gov's website, or calling MAP for assistance. Now we're going to take a look at Medicare preventative services. Medicare Part B covers preventative services like screening exams, wellness visits, lab tests, and immunizations to help prevent, find, and manage medical problems. Preventative services may find health problems early when treatment will work the best. You must have Medicare Part B for Medicare to cover these services, and these services are covered no matter what kind of Medicare health plan you have. However, the rules for how much you pay for these services may vary. So talk with your doctor about which preventative services you need, how often you need them to stay healthy, and if you meet the criteria for coverage based on your age, gender, and medical history. The Medicare and You book will also provide you information on these common Part B covered services and include guidelines for who covers it and how often they'll pay for these services. When it comes to paying for preventative services under original Medicare, you'll pay nothing for most preventative services if you get those services from a doctor or other provider who accepts assignment to Medicare. For some preventative services, you'll pay nothing for the service, but you may have to pay a coinsurance for the office visit itself when you get the services done. If you're enrolled in a Medicare Advantage plan or other Medicare plan, you get the Medicare covered preventative services, you may have to pay various co-payments. But all new to Medicare individuals get a welcome to Medicare visit with their doctor. This is a great way to get up to date on important screenings and shots and to review your medical history. The Welcome to Medicare visit is only offered within the first 12 months of getting Medicare Part B, and during the exam, the doctor will review the following: a medical and social history, height, weight, body mass index, blood pressure, and a simple vision test, potential risk factors for depression, a review of functional ability and level of safety, which means an assessment of hearing impairment, the ability to successfully perform activities of daily living, fall risk, and home safety. Individuals will also get advice to help them prevent disease, improve their health, and stay well. They should also get a brief written plan like a checklist, letting them know if any additional screenings or preventative services are needed. At this visit, the doctor may also refer for additional Medicare covered screenings if the referral is as a result of the initial Welcome to Medicare visit. There is, again, no cost if the doctor accepts Medicare assignment. This is a great benefit that many people can take advantage of. Now, Medicare does cover a yearly wellness visit as well. So after you've had Part B for longer than 12 months, you can get your annual wellness visit to develop or update a prevention plan just for you. Medicare covers one annual wellness visit every 12 months, and during that visit, your doctor again will record your blood pressure, height, and weight measurements, review your potential risk factors for depression, review your functional ability and level of safety, meaning a hearing impairment assessment, an assessment with the ability to successfully perform activities of daily living, fall risks, and home safety. They'll also give you advice to help you prevent disease, improve your health, and stay well. You'll get a brief written plan, like a checklist, letting you know which screenings and other preventative services you need over the next 5 to 10 years. And you don't need to get your Welcome to Medicare visit before getting an annual wellness visit. If you choose to get that Welcome to Medicare visit, though, you will have to wait a full 12 months before you can get your first annual wellness visit. You'll pay nothing for this exam if that doctor accepts assignment into Medicare. In addition to the Welcome to Medicare visit and yearly Medicare visit, Medicare does cover several other preventative and wellness services. This slide and the following will detail some of those wellness and preventative services that are covered by Medicare. The 20% coinsurances would apply after the annual Part B deductible is met. And for 2023, again, that Part B annual deductible is $226. But there are screenings for cardiovascular disease screenings. This includes blood tests for cholesterol, lipids, triglyceride levels to help detect conditions that may lead to a heart attack or stroke. Mammograms, screenings to check for breast cancer, colonoscopies to screen for precancerous growths, prostate screenings for including digital rectal exams and prostate-specific antigen testing. Flu shots are covered, pneumonia shots are covered, and even some of that bone mass measurement screenings. These are to see if you're at risk for broken bones. There's also many other services covered, like glaucoma testing, diabetes screenings, pap tests, and pelvic exams, all of which to have early signs of detection for cancer in the pelvic area, screenings for HIV, COVID vaccines, testings, antibody testing, treatments. These things all are covered under Medicare Part B. And when it comes to Medicare Part D covered adult vaccines, people with Medicare prescription drug coverage as of January 1st, 2023, Part D covered adult vaccines that are recommended by the Advisory Committee on Immunization Practices, including the shingles vaccine, which is recommended to adults 50 and older getting 2 doses of a shingle vaccine to prevent shingles and complications from the disease, will no longer have a deductible or cost sharing involved. This also includes the Tdap, the tetanus, diphtheria, whooping cough vaccine. Any adults who have never received one should get a Tdap. This also can be given at any time, regardless of when you last got your Tdap, but it should be followed up by a TD or a Tdap shot every 10 years, again with no deductible and no cost sharing. Now, there are programs to assist those who have limited income and resources. These programs can include the Medicaid programs, Extra Help, Medicare Savings Program. And if you think you might qualify, or if you need some help and just want extra information, give MAP a call. We're happy to set up a private appointment with you to review whether you're eligible for the programs and at what levels. Now, a quick note here about Medicare fraud and abuse. Be alert. There are healthcare services not associated with your primary care provider that may be offered or conducted as a Welcome to Medicare visit or yearly wellness visit, and may be offered as a let us send your results to a primary care provider. These direct mailings and ads, these are trying to get your business. And their approach may be telling you that these types of visits are their specialty, and that your doctor doesn't do them, or they won't do them, or that they're no cost to you, or your insurance, Medicare, will cover it, and they'll be happy to provide the service. Well, those Medicare welcome visits and the yearly wellness visits, those are intended to be facilitated by your doctor with your primary care physician. So if you ever receive a third-party healthcare service calling you, asking to do these things, offering to file claims with Medicare, let MAP know. Medicare fraud is the most common scheme that affects Medicare beneficiaries. And it can be Medicare or Medicaid being billed for services that you never got, equipment that you never got or was returned, someone using your Medicare or Medicaid card, or even a company using false information to mislead you into joining a Medicare plan. But the best way that we can help prevent is to let those folks know if you've encountered this problem. So give MAP a call. We can help report these issues and stop these folks in their tracks. MAP is here to help. So if you'd like to speak with a counselor about your specific situation, just give us a call. Our number is 800-803-7174. We are currently counseling over the phone, Zoom, and in person where available. And our services are confidential and they're unbiased. And there's no question that's too trivial. We often deal with very complicated questions as well. And for resources outside of the MAP program, there is the Medicare and You book, which is state-specific, showing specific plans for Michigan. You should receive a hard copy each fall, but you can access an electronic version online all year. There is also information at Medicare.gov, which is Medicare's plan finder and website. And of course, you can always call 1-800-MEDICARE. But for your best resource for local Medicare information, that's MAP. Our services are free, they're unbiased, and our certified counselors are not sales agents and are not affiliated with private insurance companies. So we can be your best resource for all questions and concerns Medicare. There's no question that's too small or difficult, and we've saved over $2 million for beneficiaries in your area alone. And this is just a brief statement from our funders for the SHIP program and S&P, helping to prevent that Medicare fraud. Thank you so much for joining me today. Again, my name is Melissa Devine, and I am the site coordinator for the MAP program in Livingston, Washtenaw, and Monroe County. If you have any questions on what you've heard today, please feel free to reach out to me at my email, which is mdevine@aaa1b.org. It's also listed here on this slide. Again, I thank you so much. You have a wonderful, wonderful day.